Everybody, but where the sphenoid comes back, the petrous portion of the temporal and the occipital bone all come together, but they don't come together. There's a big hole. It's known as foramen lacerum. And foramen lacerum is an annoyance to everybody because nothing really goes through it. And most of the times when you're looking through the skull from the top or the bottom, we say, what goes through this hole, what goes through that hole, what goes through that hole? And when we get to the foramen lacerum, the answer is nothing, because it's usually covered with cartilage. But it looks like something should go through it. But know that it's there and not doing anything very good. Okay, infratemporal fossa looks really simple without labels, right? It's what I was telling you before. So our zygomatic arch was traveling from there to there. So we chopped off the portion coming from the temporal bone and the portion attaching to the zygomatic bone. And we're looking deep inside, right? So here's the infratemporal portion of the maxilla. Here's the lateral pterygoid plate of the sphenoid. Okay, and here's some more sphenoid hanging out around here. We will spend, this whole area is about the size of a quarter. And we will have a 3 or 4 hour dissection of that area sometime for you to look forward to. There's a lot going on there. Ta-da! In case you wondered. Okay, some of this is old news. Okay, this is the sphenoid bone. We know that. There you go. There's our lateral pterygoid plate, which we've seen before. This part of the sphenoid that's coming up to this junction here. What's this junction again? Good. That's called the greater wing. Now you say, why is it the greater wing? Where's the lesser wing? You'll see the lesser wing when we get on the inside of the brain case. And I don't think we'll do that today. Okay, so what are they have? This is the infratemporal surface of the maxilla. We've seen that before. That's the maxillary tuber or maxillary tuberosity, the area behind the third molar. No problem there. Here's that palatine bone again, right? That's the maxilla's, the hard palate's lying right in there, deep. The maxillary portion is right there, and then the palatine portion forms the back. There's that hamulus of the medial pterygoid. Here's the zygomatic process of the temporal bone that's been chopped off, so you can see what's behind. Okay, here is a ridge on the sphenoid bone here, known as the infratemporal crest. Again, there's that lateral pterygoid plate again. And then way up here, this is a really messy area that we'll spend a lot of time on in a few weeks. This space in here is known as the pterygopalatine fossa. So it is just an area in there. There is a hole passing forward through there, known as the sphenopalatine foramen. We'll go over that again in a couple of days. And then this gap here, it's better in 3 dimensions, between the back of the maxilla and the sphenoid, right behind it, is known as the lateral pterygoid plate of the sphenoid. This gap between these two bones is known as the pterygomaxillary fissure. And we'll spend some more time with that, I think, in a few minutes. So there's from the outside in, there's the gap between the two bones, which is known as the pterygomaxillary fissure. There is the sort of empty space in between, known as the pterygoid plate, palatine bone, which is back up in there, pterygopalatine fossa, and opening from this fossa into the nasal region is an opening between, again, more palatine back in here, and the sphenoid bone, known as the sphenopalatine foramen. So if you remember that first set of definitions, the pterygomaxillary fissure is just this gap right there. The space inside is the gap between these is the pterygomaxillary fissure. The space inside is the pterygopalatine fossa, and then the hole going into the nose is the sphenopalatine foramen. So this is a hole, this is a gap between two bones, and this is a depressed area lying around in there. So well, you can stick pipe cleaners and papers and all sorts of stuff in there. So you guys can't all see this, but you up front can. So there's our sphenoid bone. There's our maxillary bone. That's the lateral pterygoid plate. So that's the pterygomaxillary fissure, that opening right there. Right? That gap right there.
Okay.
And then when you get inside, the inside area is the pterygopalatine fossa, because your palatine bone is actually deep inside there. And then there's an opening into the nasal region. Okay, we're going to get several other views of this. If you don't get all this today, you'll get lots of chances later. Well, okay, just remember that. Okay, I think we come back to it on Friday. Let's go to the top. Okay, this is the top view. Some of you have the top sawed off as a separate bone. Some of you it's maybe still attached, probably not. Okay, we've talked about some of this before. So here's the frontal bone up front, followed by the parietals, right and left parietals on each side, and a single occiput in the back. This suture between the frontal and the two parietals is known as the coronal suture, right? So if you follow that line all the way down through the body, you have a coronal plane separating the front of your body from the back. This suture between the right and left parietals on top of the skull is called the sagittal suture. And if you follow that plane down through the body, it's a sagittal plane, and it separates the right side of your body from the left side of your body. And then this suture here between parietals and occipital is referred to as the lambdoid suture, because it looks like the Greek letter lambda, in case you didn't take Greek, like probably none of us did. Okay, remember there was a nasion up here where the frontal met the nasal bones? This place back here where frontal and right and left parietals come together is called bregma. And this area at the back where right and left parietals and occipital bones come together is called lambda. It's a lambdoid suture, and the triple junction here is called lambda. And as we said earlier, this lambda there may be lots of extra little bones sort of hanging out in there that don't have any names. Okay, here we have the same area from the back as opposed to from the top. So here's our sagittal suture, separating right and left parietals where they come together. Here's our lambdoid suture, again separating parietals from occipital on either side. There's lambda, triple junction here. There's asterion again, where your temporal bone meets your parietals and occipitals in that triple junction. There's superior nuchal line, inferior nuchal line, inion, the external occipital protuberance. Okay, over here on the side, this is the suture between the mastoid area of the temporal and the occipital bone, known as the occipitomastoid suture, one on either side. There's our mastoid process you can see poking out down below. And then just from the under, you can get a glimpse of the occipital condyles on either side. So this is stuff, much of which we saw before from the side. Moving on to the lower jaw, vastly simpler. In fact, there's only one bone there, known as the mandible, but it has parts. So this lower part, overall, that has the lower teeth in it, is referred to as the body of the mandible. This upper part, this vertical part that articulates with the skull, with the cranium, back there in the temporal region, is known as the ramus. And the area where it changes from being horizontal to vertical is referred to as the angle of the mandible. Okay. Now, just as in the upper jaw, in the maxilla, right, we had the teeth facing the other direction, and then the part that surrounds the tooth roots was referred to as the alveolar region. This is the alveolar region, or the alveolar part of the mandible. And the area below the alveolar part, which is below the tooth roots, is known as the basilar part of the mandible. Okay, the place right here in the midline, where the right and left halves come together, is called the symphysis menti. It's just the symphysis between the two parts. In most mammals, the right and left parts are separate and they live independently. It's not true in people and some of our relatives. This bump, so we're getting more complicated. Who'd have thought? This bump here, where the midline, the symphysis pokes out, is referred to as the mental protuberance. And on the lower edge here, there's a little bump known as the mental tubercle. Okay, there's a little hole somewhere along here, somewhere along where the premolars and the canine are, and it can vary from all sorts of places in here, is a mental foramen. Okay, and there's nerves and arteries and veins that come through there that we will see coming down. You may have seen this in one of your other courses. There is a line here, you can see, running from the ramus. If you take the front part of the ramus and follow it down along the side of the body of the mandible, known as the oblique line. If we move on to the ramus, this vertical part, there's this little protuberance here, this part poking up, known as the coronoid process. The area in the back that articulates with the temporal region of the cranium. This part here is known as the neck. The whole area is known as the condylar process. The part that has the smooth surface, where there's actually an articulation between the two bones, is known as the head. Okay? And there's a little groove below the head known as the pterygoid fovea. Okay, so this is the neck. This whole area is called the condylar process. And then there's a pterygoid fovea in front. Separating the condylar process in the back from the coronoid process in the front is this little dip known as the mandibular notch. And I believe that was a question on an old exam. Hint, 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 hint. Okay. Now, there's a groove. You will see a groove on the inside of the ramus. And in fact, nerves and arteries and veins pass through that groove, go inside the body of the mandible, and supply innervation and blood supply to these lower teeth. And parts of it poke out here and supply innervation and blood supply to the front of the jaw. That hole is known as the mandibular foramen. Okay? There's lots of stuff going down in there, which I'm sure you'll be incredibly familiar with during the course of your career. There's a little protuberance on the medial side of that mandibular foramen known as the lingula. Okay? So that's most of the mandible. Let's see, I'm sure we can find other stuff on the inside view. Aha! So there's our mandibular foramen, which goes down into the mandibular canal on the inside. There's that little lingula again. On the medial side, on the outside, the medial surface of the ramus up here is a groove called the mylohyoid groove, where there's a nerve that goes down called nerve to mylohyoid, which we will dissect out in future days. There are sort of depressed areas on the inside of the body of the mandible. The area up here, just below the teeth, is known as the sublingual fovea. There's actually gland up in there. And there's a groove down in here, another depressed area known as the submandibular fovea, which has another gland hanging out there. Up front, you can see this is where the right and left sides come together, and there are two little depressions known as the digastric fossae, where muscles attach. You actually saw where those muscles came from the back of the skull, and here's where they're attaching up front. We'll dig them out. Okay. On the inside, the back side of that symphysis, where the midline, right? There are bumps known as the genial tubercles or mental spines. Okay, and if there's two of them, the upper ones are called the genioglossacal tubercles, and the lower ones are geniohyoid tubercles. These are where some muscles that are down here on the floor of the mouth, or the floor of the floor of the mouth, where they attach to the front of the jaw. So they're called the genial tubercles or mental spines. So you'll see some muscles with the sacs, and they all attach right there in that midline. So there's the mylohyoid groove. What is this area called again? Good. And this one called? What? Don't all speak at once. Come on, Amanda. What is it? Coronoid process. Good. Okay, moving right along. Oh, is that true? Oh, no. Okay, let's go back again. Shall we go over it again? We got hours. No. But you guys are just having fun. Okay, now there's another one tomorrow. Tomorrow we're going to look on the inside, and then it gets really ugly. Does anyone have any questions? Okay, well that's good. Can we have the quiz now? Okay, so if you want to come up, we've got, like I say, here's one that's painted. You can sort of see more about these things. Here's this exploded skull. Tomorrow I'll bring in some of these bones that are pulled apart, and you can look at the individual parts. What do we have? Oh, we've got tests. You know what? We can keep them. I'll give them to Dr. Cadella. That's all right. It's easy just to hand them to you. You go right. Okay. Whoa. One more second. As requested, we are